Hey everybody, good afternoon. I hope you're getting out enjoying some sunshine today because the snow is melting. I want to talk today about a really common thing that walks in my office, what to do when your back locks up or you twist wrong and you are, immediately have grabbing pain and you literally can't move. Because that's what I see a lot. It's been an epidemic this week, people who can't walk. And as awful and painful as that is, I'm always happy when they make it into my office because I know we can help them get better faster and not have a chronic issue from that. So what to do right away if you find yourself in that position where it's classic, you didn't even lift something, you just bent over to, tie your shoes for what I've heard it all. Usually it's not something heavy, it's just a little bend over and twist that gets you and you can't move because your back is locked up and your muscles are in spasm. First thing to do is to get some ice and rest and lie down. The best way to rest your back is actually lying down. So either on your side with pillows between your knees, on your back with pillows under your legs. Some people will find that the only position that makes them comfortable is laying on the floor, a nice firm surface, with their feet up high, like legs up on the couch, for instance. Recliners, not so helpful. They usually put the back in a really not good position. So avoiding sitting, obviously. Like I said, ice packs. What is classic is people will put a heating pad on it. Do not do that. Heating pads are not good for acute things, for new things. Heating pads are only helpful for like arthritis and long-term, more chronic issues that just need some warmth for older individuals. But do not put a heating pad on acute back pain. Use ice, 20 minutes on, 20 minutes off. If you have some biofreeze or something cooling that's safe, you can rub that on. Gentle stretching, like bringing your knees to your chest as you're lying on your back. Drinking extra water is helpful as well. And you call your chiropractor because the sooner that we get you in our office and get you evaluated and adjusted if that's what's indicated, the faster you're going to be back to normal. Some statistics for you. Low back pain is the single leading cause of disability worldwide. 80% of the population will experience a back problem at some time in their lives. And back pain is one of the most common reasons for missed work. Most cases of low back pain are mechanical or non-organic, meaning they're not anything serious. They're not inflammatory arthritis, infection, cancer, fracture, etc. They are mechanical, and which means you need a chiropractor. So the sooner I see somebody after an episode like this, the faster they are going to get over it. When you're in pain like that, you probably really don't want anybody to touch you. And that is, I totally understand that feeling. When we have somebody come in who literally can't walk, who is helped into our office, the first thing I'm doing is taking a history. I'm asking this patient questions about what they did, what their history is like, and I'm ruling out red flags. Things that would cause me to send the patient to the ER if that's necessary, or send the patient for some x-rays if that's necessary, or refer to another doctor if that's what they need. That's what I do. If that's not necessary, if the patient doesn't have any red flags, then I carefully get them onto my table. We have a table that goes vertical, that comes all the way up, and that is an absolute lifesaver because we have a number of patients every week who literally cannot get on our table, and so we stand the table all the way up, and then you just lean against the table and the table brings you all the way back down really comfortably. And I'm very, very gently adjust the spine when there's that much muscle spasm. I'm really, really gentle the first day just to begin to reduce the inflammation and begin to restore the normal motion of the spine. But don't be scared to come get adjusted when you're in muscle spasm like that because we're really, really gentle. It kills me to see a patient who has maybe waited 2 weeks with something like this, or oh my word, like 6 months with something like this without coming to see a chiropractor, because very often it doesn't go away on its own, or perhaps they're given opioids, and we all know that we've got this awful opioid epidemic in this country, and narcotic pain medication is not the first line defense for acute low back pain, absolutely. There are so many other things we do before narcotic pain meds. In my experience, as I see patients who have tried taking aspirin and taking ibuprofen for things like this, they really don't even help. They are not enough to help with pain like that. And in my experience, most people that we're treating with acute low back pain like this don't require a prescription, for muscle relaxers or pain medication. We're usually able to help you get back to normal functioning without the use of those things. If necessary, I absolutely refer out for those things. And there are cases where someone is just in so much pain that they can't get through the first few days of that acute phase. And so I refer to the docs I work with who will help them with some pain meds. So, like I said, the sooner the better. I'm going to review the home things. Ice is necessary. Lying down, not sitting, not driving, not standing for too long. Definitely no lifting, bending, or twisting when you're dealing with this. Gentle stretching. You're basically going to avoid things that hurt and do things that feel good, like gentle stretching, walking. We've got to keep these things moving. And so I'm getting people walking as soon as possible to their ability level, to where we're not making the pain worse. Drinking extra water is helpful, and no heating pads. So please drop any questions you might have about this in the comments, and let us know if we can help you. Have a great day.